Hi everybody, this is Dr. Michael Ellman with Pegasus Spine and Joint, and I wanted to talk to you today a bit about whiplash injuries of the cervical spine after having a motor vehicle accident. Typically, these occur after being rear-ended. What happens is that the patient is in their seat, typically with a seatbelt on, and when they get rear-ended, the car will go forward. However, they will be stuck in their seat and the neck will go back and then forward, what we call an extension-flexion movement or a flexion-extension movement. What happens here, if this is the back of the neck and this is the front of the neck, is that these joints here, called facet joints, will get scrunched or squished, and then the ligaments and the tendons and the muscles also get significantly injured in the back of the neck as well as the front of the neck. Typically, what will happen with these patients is that they will present with obviously neck pain, pain in their shoulder blades, sometimes pain going down their arm or all the way down the arm, sometimes with numbness and tingling in their arms. They will also present with pain sometimes in the front of their neck to the extent of sometimes that they can't even swallow. Typically, some of these patients will also have neurologic symptoms. What's happening when the neck goes back and forward like that is that the head is attached to the neck and the brain is inside the skull, and the brain is soft and the skull is hard, and the brain may be injured in what we call a minor traumatic brain injury. The patient does not have to have a concussion for there to be a minor traumatic brain injury. Some of these patients will present with headache, blurred vision, dizziness, ringing in their ears or tinnitus, and overall confusion. This is what we call post-concussive syndrome, and we also identify that. The patients come in, typically we'll assess them, we'll go through their story, and go through a thorough physical examination. Once we've done that, we will typically order x-rays to make sure that their bony structures are intact. What we'll do typically is order medications such as an anti-inflammatory medication, a muscle relaxer, sometimes a topical anesthetic or anti-inflammatory medication, and pain medication if needed. We may give them a soft collar for a day or two to help with support and comfort. Generally, we do not like them to wear a soft collar or cervical support for very long, as it will inhibit range of motion of the neck, which we want to retain or increase. The patient will then be sent for physical therapy and or chiropractic care for mobilization modalities such as ultrasound, heat, ice, and stabilization of the neck, and work on strengthening. Generally, we'll follow closely with the patient and make sure that they are progressing. Most of these problems take care of themselves and generally resolve within 4 to 6 to 8 weeks. If they do not, however, we will do something different. A lot of times we'll get an MRI of the cervical spine to assess the discs, particularly if they have any numbness and tingling in their arms, and make sure there is no nerve root impingement. A lot of times what we may do then is talk about doing injections in the neck. We would start off simply with what's called a trigger point injection, where we may inject some of the muscles to help with the spasm and inflammation in those particular muscles in the neck to see if we can increase their range of motion and help their therapy. Many times we have to address these cervical facet joints that I talked about previously, where we have to inject these joints with a combination of cortisone and anesthetic to help with the inflammation in these joints, as we feel that cervical facet joints are the major cause of chronic neck pain after whiplash injuries. Sometimes we have to talk about doing epidural steroid injections if there is a disc herniation in the neck that is not improving with therapy.